Hey everyone, welcome back. It's Dr. Kuhn again from Providence Chiropractic Clinic. Today I wanted to talk to you about why we shoot X-rays in upper cervical care, when you might need X-rays, and what decision making we go through in order to determine whether we have to shoot X-rays on you or not. Now, unlike some preconceptions about chiropractic care, we don't shoot X-rays on everybody. We actually go through a lot of filtering and testing with patients to find out whether or not they have a misalignment before we take the pictures. And when we shoot X-rays, we're looking at them not so much to scan for pathologies like breaks or tumors or anything like that, which we do check for anyway, but we're looking for really the biomechanical understanding of what your injury looks like, where you're at, and how we can best approach helping you get back to where you need to be. When we shoot X-rays on you, we're really precise in how we take them because we're measuring very small misalignments of the spine. And so in an upper cervical office, you're going to have a lot more mechanical paraphernalia around your X-ray. We've got laser beams for lining you up. We've got head clamps to hold you still and keep you centered. There's a lot more finessing to getting the X-rays than a typical set of medical X-rays. Be able to use outside X-rays in order to do the work. Most medical X-rays, they're looking to get a picture that goes through your body so they can see if you've developed any kind of anomaly or pathology that could explain your symptoms. In our office, we're looking at the X-rays to measure very precisely where everything's at, and so setup is key. We spend a lot of time and a lot of effort getting exactly the X-ray we need to be able to measure what's going on and how to treat you. So that kind of explains why we would do them in the first place. When you do need a new set of X-rays, is not just any old time you come in. Most times, once we've got you figured out, and we figured out from an alignment perspective how to get you from where you're injured back to where you're supposed to be, then we've got the key for the lock. And the weak point of your particular situation is always going to be back into that old injury. And so we don't have to shoot X-rays on you every time you're out of alignment or every time you're in the office. The only times we would reshoot X-rays is if we find a reason for you that we suspect you've got a difference in your misalignment, if something's changed. Most commonly in our office, we don't see that from day-to-day type traumas. If you bump your head getting into the car, slip on the ice, fall and wipe out when you're playing in the backyard, could knock you out of alignment, but it's not generally going to create a new injury. Most commonly when we see new injuries, it's due to two big factors. The first one, car accidents. 2,000-pound bullets, even at low speeds, do not play nice. You've got a lot of force involved. Your body is strapped into the vehicle with the seat belt, but your head is not, and there is a lot of shearing action that can happen when you have any kind of change in speed there. And so even fender benders can create new misalignments for people. The other times we'll see new misalignments happen, most commonly, is surgeries. Anytime anyone goes under general anesthetic, you're a jellyfish. And your atlas is primarily held up here by muscles, which means when they knock you out and then intubate, position you, move you, put you from one place to another, do whatever they have to do to keep you alive and get the procedure done that you're under for, they can cause things to shift in any given direction up in your neck. So that's another time when we would do an in-depth evaluation to find out if you look like you've changed your misalignment and likely shoot another set of X-rays so we can make sure that we're treating you appropriately and getting you on track the way you should be. If you have any other questions on upper cervical care and want an input from me, then post them below and I'd be happy to answer any of your questions. It's Dr. Ben Kuhn from Providence Chiropractic Clinic. Have a great day.